Good morning, everyone. Welcome to CureDuchenne's 2022 Futures.
That's what I was going to say.
Old habits die hard.
Welcome to CureDuchenne Futures 2022 Building Community. It's great to see new friends, old acquaintances. It's like a family reunion that just keeps growing. We're very grateful for you being here. It matters that we get together. It gives each of us hope. I challenge each one of you. I tell Hawken this all the time. Go first. You're in an elevator. Don't just stare at the numbers. Say hi to the person that's next to you. It's okay to talk to each other in the elevator. You know what? In the bathroom, you can. Guys don't do it, but you can talk to each other in the bathroom. Get to know people, and you're gonna gain from that. They're gonna gain from you being bold. So go first. By the way, I'm Paul Miller. This is Debra. This is Hawken. And for those of you tuning online, thank you for being online, and we hope to see you next year. We really look forward to this weekend. Lots of memorable stuff going on. We have a keynote speaker that I've gotten to know the guys a little bit. Justin and Patrick, they're fantastic. What a great story. Do not miss that. They're coming up next. Awesome. We have what I consider some significant, this is the stuff I can't wait to see. In addition, presentations and panels on next generation technology, gene therapy and editing. It's great stuff that you're going to learn. And probably my best skill is the social events. That's what Debra tells me. I'm Chief Fun Officer, and so we have an opportunity to let our hair down a little bit in each evening, maybe before that. And exhibitor showcase, lots of great stuff. You might even be able to supercharge your chair and learn about all the latest things that are going out there to support. And not least, Hawken knows this one, e-gaming. We have e-gaming, and that I might think we're going to lose Hawken here shortly to that. As most of you know, Debra and I did not sign up for this 20 years ago, almost 20 years ago. But when we found out Hawken was diagnosed with Duchenne, we knew we had to do something. And this is exactly what we thought it'd turn out to be. Thank you, Tim. No, it's been an amazing journey. We are very grateful for the support, the progress, the scientists, and this community is important to keep growing and keep building on this. And with that, I'd like to introduce my better half, Debra, CEO, co-founder, CureDuchenne, and just all-around rock star.
Thank you. Thank you. And Paul definitely is the Chief Fun Officer, and we can go, he's never off, no matter where we are, vacation, dinner, whatever. He's always engaging whoever he can find into our cause, and has made great progress. So I'm so excited to see everybody here. I really enjoyed getting to know some of you over Zoom, but I just made the decision that I am done watching little yellow squares to get to know people, and so really happy to see the effort that everybody made to come here today. A lot of new faces, some old faces here, some faces I've known for a long time. Anyway, it's been a while. I would love to update you on some industry happenings and what's going on with CureDuchenne lately, but I would like to also acknowledge our sponsors who make this whole weekend possible, the biotech and pharma companies that are sponsoring this. We appreciate so much your support. We've worked with them now for 19 years, and I have to tell you that when we get to know them, they laugh with us and they celebrate when there's success, and they actually cry with us when there are disappointments. And drug development is never a straight line. It's 2 steps forward, 1 step back, and so they have been so committed to our community, and just big, let's give them a hand of applause. Thank you. So we're here talking about building community and taking action. As Paul said, this was not something we signed up for, but we coined a phrase very early on, action is therapy. And for us, for our family, there have been a couple things that have been really, really important. And it's taking action and knowing that no matter what happens, we're doing absolutely everything we can for our son and for the rest of the community. And it really does help us get through every single day, along with our faith and knowing that we have a purpose and a reason for being here. So just a little bit of background on CureDuchenne. We have been funding research for the past 19 years, and we have actually funded 44 projects. I think about 15 of them have progressed to clinical trials. And we're really proud that our early funding, along with a couple other foundations, like Foundation to Eradicate Duchenne, funded the first drug that was ever approved through Sarepta, called Exondys. And it's these early funding mechanisms that we've created that have really enabled the science to move out of the lab and into the biotech companies that actually develop the drugs. We have a venture philanthropy model, and that means that we actually raise money and we invest it, small amounts of money, seed funding, into early stage science. And we help these companies get to a proof of concept so that they can then move on and get the hundreds of millions of dollars that it takes from venture capital companies and from pharma companies to actually get these drugs developed and approved. And in fact, over the past 19 years, the companies that we've invested in, the follow-on funding, the funding that has come from VC firms and from biotech and pharma companies, has resulted in almost $3 billion into the projects that we initiated. And so that's the kind of leverage that we have. So when we raise money and we invest a small amount of money, we're able to leverage those funds and get those drugs into the drug development pipeline. A couple examples. There's been some things in the news lately. We've got some good news coming out. One example is Dr. Kevin Flanagan back in 2010 had a great idea and a scientifically sound idea of looking at duplication mutations, and he needed some funding for that. So in 2010, we started funding his preclinical work, and we funded him all the way through 2017, over $1 million. And we were really excited just, I think, last week to announce that, or he announced that his DUP2 exon skipping using a U7 delivered by AAV vector created full-length dystrophin in patients in an infant with Duchenne. That's phenomenal, yes. This is what the Holy Grail, right? Full-length dystrophin, that's what we're all looking for. We have a long way to go still, but every time we just get proof of concept, it drives us. It drives us forward. It creates more interest, more investment in the Duchenne space, and so this is a really phenomenal happening. And we're excited that other nonprofits come in after that and other pharma companies come, but we really need to stay focused on finding that early science and being the ones to take that risk. In fact, CureDuchenne, outside of the federal government, is the largest funder of Duchenne research right now. In 2010, thank you. There's also, so CureDuchenne has been very, very active in exon skipping from the very beginning when we funded Prosensa that was bought by BioMarin and funding Sarepta. And since then, again, we have proof of concept that exon skipping can produce dystrophin, which is phenomenal. But we knew we had to make it better. And so since then, we funded 4 additional companies that have next generation exon skipping. Avidity and Dyne are using antibody-delivered exon skipping, and Pepgen and Entrada are using novel peptides or novel delivery mechanisms to target muscle tissue for exon skipping. And we're excited about gene therapy, and it's going to continue to move forward, but there is a big, big place for exon skipping in our therapeutic pipeline. Speaking of gene therapy, we anticipated that this was going to be a very effective treatment early on. And in 2016, we funded a little tiny biotech company called Bamboo Therapeutics, which was wanting to go into clinical trials for Duchenne. And they did not have the resources. And so again, our funding came in at a very crucial time. Again, not a lot of money, but just crucial timing is when we invest. And fortunately, Pfizer bought Bamboo Therapeutics in 2016 also, and went into clinical trials in 2020. And we're proud to say that they have now entered a phase 3 trial and are recruiting patients in the US also. One other really interesting investment that we made was in 2017 with Dr. Eric Olson at UT Southwestern. We co-founded a company called Exonics Therapeutics. Exonics and Dr. Olson had the idea and the first company moving forward with gene editing for Duchenne, which we believe very strongly is going to make a big impact. And fortunately, Vertex Pharmaceuticals also saw the value and bought the company in 2019. So this just shows how our small early investment can be magnified by having good science and by kind of teeing these things up so that the large funders can come through. There are challenges with gene therapy. We all know that. So many families or so many patients have neutralizing antibodies. There's a huge quantity that we have to deliver. There's just many, many challenges. And again, we anticipated that several years ago and started funding next generation gene therapy and delivery mechanism. And so we funded Chameleon, which basically has a technology to cloak the AAV virus against the immune system. CodeBio, who has a 3 DNA platform to deliver hopefully full-length dystrophin without using an AAV vector. Myosana is doing a similar strategy with full-length dystrophin without AAV. And then Geneo Bio is another next-generation gene therapy company. All of these companies are in preclinical now, but they're really moving towards the clinic, and we're excited to add them to our arsenal. So, how can you help? As we said, taking action has been just the most therapeutic thing for us that there has been. And we talk with so many researchers and scientists and biotech companies, and what we heard over and over again, they need biospecimens, they need blood, they need serum, they need these samples to test their drugs on. And it's really, really important. And so we created CureDuchenne Link a few years ago, and this is an integrated biobank where you can contribute blood and tie it to your medical records, your self-reported surveys, and genomic information. And it provides a wealth of information to the scientists and the biotech companies to actually develop and test these drugs. So as a community, this is something that is really simple for you to be able to do. And Anna Christensen's going to talk in just a few minutes about how you can participate in that. It's really important because if we have every single pharma company and biotech company keeping their own biobanks, they're all going to be coming to you separately asking for samples. And not only that, but they don't use them all. They use a small % of it for their actual studies. And so a lot of that goes to waste. CureDuchenne Link is an independent, neutral biobank that all of the companies can come to and access these samples. So I really encourage you to participate in that. And of course, caring for our community. CureDuchenne, basically, when Paul said we knew exactly what we were going to do, wrong. We got up every morning, and what was in front of us is what we did. And then we took care of that, and there was something else in front of us that we needed to do, and we took care of that. And basically, our model has evolved of just kind of identifying gaps. We're parents, and we just see things that need to be done, and we see holes. And so we create programs when we see a gap and a hole. And the CureDuchenne Cares program, and workshops, and sessions, and dinners, and coffee talks, and webinars, and resources are all things that have come about because of seeing gaps in the care and family support. The physical therapy program, I think everybody here knows Jennifer Wallace and Doug Levine. They're our rock stars. We understood early on that how important physical therapy is, and that a lot of times these guys lose ambulation not because of muscle weakness but because of contractures. And so Jennifer has been with us before CureDuchenne was founded. She was just out of, she reminded us yesterday that she was Hawken's age when she started working with Hawken. And so I think all of you understand the value of physical therapy, and we're really proud of that program. We also have the CureDuchenne Champions, and Leslie is one that you met. Lucy Nilsson, I don't know where you are, but this is a champion that when their son has a serious fracture, serious break, and 2 weeks later, they're here traveling across the country to be here with all of you. So thank you for that. So again, I'm right on time, and I just want to thank you all for being here. And we love you all. We're so excited. We want to work with you. And please let us know what your needs are. And if you see gaps, please let us know. And with that, I'm going to turn it over to the star and the reason for us all being here today.
Oh, thank you, everyone, for being here. And thank you, Mom and Dad, for being awesome parents. I'm very blessed to have them, to be born to them, I guess. It's really great to be here with all of you and meeting new people. And it's been too long, and I'm glad we're finally here in person. And thank you all for making the time to come out here and be here and learn about everything that we're doing. I wanted to take a second here to introduce our keynote speakers. So crossing 500 miles of mountains, desert, and mud is tough, as you can imagine. Now add a wheelchair on top of that. That seems impossible, but these two men have shown me what's possible in life, even with a disability. I learned that the power of friendship conquers all. I learned that asking people for help gives them joy. And I learned that once you let your independence go, love will flourish. I think that's something that we can all learn from. And I hope to learn even more from them as they come up and talk about their incredible journey today. But before Justin and Patrick come up, we have a short video to show you. And thank you so much again. Hope you have a great time.
Enjoy.